So I performed upper cervical traction in 5 degrees of flexion, and that was sustained for 3 minutes. And I'm below the mastoid, and now I'm pushing on the transverse process of C1, and there's much freer mobility. Same thing on the right side. Also, I didn't demonstrate on my previous video, but coming up underneath, just below the occiput, coming underneath C1, I was unable to impart rotation like this. Okay? And so we've certainly made changes with joint movement through changes in muscle tone, through changes in the nervous system. Okay? And the traction seems to be the key to those changes. And I come underneath C1, and now I can spring him forward. There's ease of movement, okay? Before, his head was so heavy because that second joint was compressed, and now I can lift your head freely. And now when I traction you, now the whole body moves. I see movement in your feet, and now I traction it. Now I do a spring test, and that motion translates down through that. So I'll lift your head up in full flexion, and I rotate it now, and there's distinct increase. That's 45 degrees both ways. And I'm going to just move the camera view. I'm just going to drop the camera out of view now, and then I'm going to drop your head back in extension. Okay, and that was quite restricted, and now I can traction the upper cervical. I can take up the slack, then I can spring it, and I see your feet bob up and down. So your upper cervical mobility, especially at the atlantoaxial joint, is much improved now. Okay? And I'll teach you how to keep that later.
Okay.